So we're gonna be putting some punctal plugs in today. Dominic is gonna have LASIK surgery soon, and what's really important with LASIK is that your eyes are not dry at all before we do the procedure, and we wanna help him after as well to keep the tears on the eye. So one way we can do that is by using punctal plugs. There's two different kinds. So this one here is a collagen punctal plug, and it is teeny tiny. And these ones typically last about 2 to 3 months, and then they'll go away. If you have more severe dry eye or we're looking for a more permanent option, then we'll use a silicone punctal plug, which looks like this. The plug portion, again, is just at the very bottom. This whole thing is just an inserter. And this is permanent, but it's semi-permanent. We can remove it at any time if patients feel like it's uncomfortable or it's rubbing or irritating. So what I typically do to start is I will use a punctal dilator, which is kind of like a little probe that opens up the tear duct. The tear duct is actually right here. A little tiny hole in the corner, that is the puncture right there, and that's what we're gonna be putting the plug into. So here's what it looks like out. This end is the dilator, and then this end is where the plug is. This button is a little release button, so once I get it into the pore, I just hit the button and then it will let go. I'm gonna re-dilate that a little bit more. And we'll switch to the plug side. And release. And you can see that little white dot is the punctal plug. How's it feeling?
Not bad at all. Felt a little bit of pressure when it was going in, but aside from that, no worries.
Perfect. And it's common to have a little bit of irritation right after we put the plug in, but usually within a day or two, you won't feel it at all. So this is a really common procedure that we perform in the office all the time, and it should last for as long as, it stays in the eye. We can always remove it if it becomes a problem, but if you have severe dry eyes, you just had surgery, cataract surgery, LASIK, and you're struggling with some dryness, this is a really great option to help out with keeping that tear film nice and stable and letting those eyes feel less dry.
Cool. Thanks.
Cool.